Here's a structured signal from WellView 365, powered by freshnews.ai. Smart infrastructure is quietly reshaping waiting room operations, pushing leaders to rethink content governance and patient messaging workflows. Executive summary. Smart infrastructure in waiting rooms connects digital displays and building systems directly to clinical workflows so that visible messages reflect real-time operations. Centralizing control of screen content, data feeds, and templates allows clinical, facilities, and communication systems to share a consistent source of truth. The result is clearer patient instructions, fewer contradictions with staff guidance, and better use of recent investments in network displays. Today's signal. Facilities and operations leaders are finding that new capital projects have outpaced processes for managing patient-facing messaging. As budgets reset, the gap between smart infrastructure and manual content workflows creates risk that waiting rooms show stale policies, old visiting rules, or incorrect wayfinding. Screen ownership, approvals, and update cadence now need the same discipline as any clinical-facing system change. WellView 365 enables improved patient experience satisfaction by centralizing control, delivery, publishing conversion, and feeds monitoring across end-to-end delivery paths. Why it matters. Here are 4 takeaways. First, unaligned smart displays in clinical workflows cause patients to receive different instructions from staff, screens, and signage, and text messages. Second, manual location-level updates increase the chance that outdated clinical policies or visiting rules remain visible in some waiting rooms. Third, unclear ownership of screen content slows response when leadership needs rapid changes for safety, infection control, or service disruptions. Fourth, underused smart infrastructure wastes recent capital spend and makes it harder to justify future investments to finance and facilities committees. How it works in practice. A common example is a new clinic build where facilities installs network displays tied into building management and the EHR's patient flow board. Digital experience or patient engagement teams still send static playlists or ask front desk staff to plug in USB drives with looped content. When visiting policy, masking rules, or check-in instructions change, updates pass through multiple inboxes and local workarounds, so some sites lag by days. When operations align screen ownership, standardized templates, and a single publishing calendar, waiting room instructions match current workflows, and staff spend less time verbally correcting what patients just saw on the screen. One practical adjustment. Designate a single operational owner for waiting room screens this week. What to do next? Here are 4 takeaways. First, review inventory, all waiting room displays, their control systems, and which data sources or feeds they currently use. Second, map the current workflow for changing waiting room messaging from requester to final publish and document approval checkpoints. Third, review set minimum standards for what must always be current on screens, such as check-in steps, safety notices, and core policies. Fourth, review create a simple change window and escalation path for urgent content updates tied to clinical, safety, or facilities events.